Okay, so today's video is going to cover skin disorders. I'm going to give a disclaimer and a word of warning that the pictures of some of these are kind of gross. Okay, so you may, I'll warn you if a gross picture is coming up, so you can, if you're squeamish, you can not look. Or you also may not want to watch it where, like your 5 or 6 year old younger sibling is around and, and can see it. So our first skin disorder here is a decubitus ulcer. So a decubitus ulcer is also called a bed sore. So these are caused basically by pressure. And so the patient is laying for too long in one position. And really what happens is blood flow becomes restricted. You can see here in the stage 1, you see how the bone is here at the bottom. So as the patient is laying in one position, it's putting pressure on the skin. And basically it's squeezing this tissue right here between the bed that the patient is laying on or the wheelchair that they're sitting in and the bone. And so what it will do is it will restrict the blood flow. So these are caused by pressure that is going to cut off blood flow. And some treatments for these are going to be antibiotics so that you don't have any form of infection. Okay, so antibiotics would be part of the course of treatment for these, as well as removal of the dead tissue. Okay, so treatment for this is your abbreviation that you'll see for treatment here. Treatment for this will be antibiotics. Okay, and then removal of the dead tissue. As you look at this, you can see these sores advancing. The stage 2 definitely has become an open wound here. Okay, stage 3, it's gotten a lot deeper. Stage 4, it's gone all the way down to the bone. So you are at a high risk of infection at this stage. Okay, even at stage 2, where you have this wide open wound that can become infected, which then that infection could spread to the rest of the body. So in addition to the antibiotics as a preventative there, they're going to remove the dead tissue. Okay? And one of the ways that they're going to do that is with debridement. Okay? Debridement is basically you're going in and having surgery to remove the dead tissue. You can see all this like brown stuff in the picture here. They would need to go in and clean all of that out. So the debridement is the process where they would do that. They also can do what's called a vacuum-assisted closure. My little pen is being really difficult today. So the writing is being very slow because it's being a pain. Okay, so a vacuum-assisted closure. Okay, and so the vacuum-assisted closure, basically they take a vacuum tube and it draws out all the moisture from the ulcer. Okay, because the moisture allows the bacteria to thrive and to grow. So it pulls all the moisture out and then they'll remove the dead tissue later. Okay, so word of warning, an icky picture is coming up next. So you may want to close your eyes. I know in Edpuzzle you cannot fast forward, but you will also may want to listen to what's being said. Okay, so these are some common sites that you will receive bed sores. You can see there are places basically where bone, like your shoulder blade right there, okay, your hip bones, there are places where bone is going to be helping put that pressure to restrict that blood flow. So you can see all the joints as the patient is laying. So these are common sites of these bed sores, of these decubitus ulcers. Okay, so pretty much described right here, those kinds of sites. Little fat and muscle over bone. And so that's going to be a common area. And you can see here, this is an example of a decubitus ulcer. So this is all dead tissue that would need to be cleaned out and removed. And this is a very large open wound here that's going to need the antibiotics to try to prevent infection. Okay, the icky pictures are gone for now. So we're going to talk about burns real quick. So there's a variety of things that can cause burns. Okay, obviously heat or temperature. But we need to keep in mind that burns can be caused by other things as well. So in addition to heat, you have concerns of burns forming due to chemical exposure, electricity, so you have electrical burn, okay, as well as UV exposure, which is sunburn. right? So sunburn can form, and that obviously can be bad enough that it requires some form of treatment. Okay, so all of your burns, though, are basically going to result in the same situations, right? Whether it's from heat, whether it's a chemical burn, a electrical burn, or a sunburn due to exposure. So we have three basic types of burns, and we're going to look at all three of them bit by bit, so you don't need to get them down right now. So the first one we have here is a first-degree burn. So a first-degree burn is only in the epidermal layer. So you can see examples of that here. Okay, we've got first-degree burns here. Both of these are basically sunburns. So a first-degree burn is only in that epidermis. Remember that epidermis is our outermost layer of skin, the topmost layer of skin. It's that dead skin layer, right? Those dead cells have been pushed up to the top. So because it's only in the epidermal layer, a first-degree burn is usually relatively mild in pain-wise. You'll get some redness, like you obviously see here, and they'll heal pretty quickly. What you won't usually see with a first-degree burn is any kind of blistering. Okay, so your pictures are going to start to get a little bit ickier now as we move in. So a second-degree burn, okay, so you can see a second-degree burn here, you're going to have some blistering happening. You can see the blister happening there. So a second-degree burn is going to go through that dermal as well as that epidermal layer as well as down into the dermis. So that second-degree burn is going to go through both layers of skin. It's not going all the way through the dermis, though. You can see in your diagram here, right? Here's our epidermis, this uppermost layer. So the first-degree burn just covered that epidermis. Second-degree burn, the dermis is a really big layer, right? The second-degree burn is going down into the dermis, but not going all the way through the dermis. So these are going to be a lot more painful. You're hitting those free nerve endings that are up here in the top of the dermis. Remember, those are for pain. Okay, so the second-degree burn is actually one of the most painful, and you're going to see that blistering. This is also called a partial thickness burn. You can see the blistering down here happening on the bottom. Okay, so our last type of burn here is what's called a third-degree burn. So a third-degree burn, you can see it's gone all the way down, okay, into that hypodermis, all the way down through the epidermis and all of the dermis. So that will make it a little bit different than the second-degree burn. So all through that epidermis. Okay, these are actually not quite as painful as a second-degree burn because you've burned all the feeling away, right? All the feeling would be happening in here, and all of that's destroyed. Usually where it is the most painful, it's along the edges where you have the second-degree burn there. Okay, these are going to appear grayish or black. You can see in the pictures how the fingers here have blackened, how the skin here has blackened because this is charred, basically. So they'll appear grayish or black, and these are going to require a skin graft. Okay, let me see if my pen will work. And we're going to talk right now about how a skin graft works, how to make one. Okay, so a skin graft, you can see one happening right here. So basically, they have to harvest some skin. You can see right here, they use what almost looks like a vegetable peeler. Okay, so they harvest some skin, and they have this layer of skin here. The layer of skin is then put through this machine here that almost looks like a pasta maker called the mesher. And if you look closely, you can see how this now meshed skin looks almost texturized. You can see how it looks texturized here. What that does is that allows for skin to grow between. It acts like a mesher, like a screen network for the new skin to grow in between. Okay? And that new skin, that skin graft will be stapled on. You can see in this mesh skin graft picture here, this is after 5 days. So you can see the staples where they've put it in. You can see the mesh and the raw skin under the raw tissue underneath that's going to grow up between that mesh. Okay, and then this one over here has been a year. It's the same arm, it's the same person. Yes, you can still see the pattern of the graft, but you can see how it's no longer an open wound, right? And its skin has has grown in between all those little openings, all those holes, and covered the wound. And one of the things that you guys will need to be aware of is what's called the rule of nines. And so the rule of nines is what the doctors will use to quickly assess how much surface area has been covered by burns, because you may become a more critical patient depending upon where your burns are, and or while you might not have a whole bunch of third-degree burns, if you have enough second-degree burns, it can still become an issue. So basically the body is divided into areas, and each of those areas are counted as 9%. So if we look at the map here, we can see how the entire head and neck is 9%, right? And then we've got 18% on basically the front of the torso is divided into the top half and a bottom half. So 9% for each there. And then it's the same on the back, right? So I've got 9% and 9% on the back. So far in my rule of nines, right, I have 1, 2, 3, 4, 5 areas, right? All of the head, 2 on the front of the torso, 2 on the back. If I look at my arm, right, I can see that my arms, are each going to be 9% in total. 4.5% for the front of an arm, 4.5% for the back of the arm. So there's one more 9%. And then again, because I have 2 arms, there's my second 9%. Since our legs are longer and thicker, they are 9% for the front and another 9% on the back. So my right leg has 9% on the front, 9% on the back. Left leg, 9% on the front, 9% on the back. If you do your math real quick, right, I have 99% of my body covered. And so that last 1% there is going to be the genitalia. And so that's how they can quickly estimate what your amount of burns are. Again, if there's, I don't remember off the top of my head, I want to say it's like 32 or 35%, or greater is second-degree burns, then you become a very critical patient. If you have third-degree burns on your hands, feet, or face, you become critical. So this rule of nines allows for a very quick assessment. So y'all will want to know how the body's broken into those rules, to those groups of 9. So now we're going to move into some infections in the skin. Okay, and so we're going to start with a common infection. Okay, herpes. Herpes is viral. Okay, and there's a wide variety of herpes diseases. Okay, many of which that y'all have been exposed to and you've had. So some key points regarding herpes, the herpes virus. Okay, the herpes virus, regardless of which kind it is, if you look here, you'll see like this child has varicella, there's zoster there, there's simplex there. So there's 3 varieties right here in these different pictures, but they all have some things in common, right? So some commonalities that they're going to have is they're all going to have small, pretty painful blister-like sores. Okay, and something else that's key for herpes infection is that it stays forever, right? The herpes virus can go dormant and then return, but it never goes away. For example, herpes simplex down there at the bottom, herpes simplex is cold sores, right? That's what you see in the picture there is a picture of a cold sore. If you know anyone that has cold sores, right, they develop the fever blister of the cold sore, it goes away, they get stressed out, it comes back, right? You never, ever, ever actually get rid of a herpes virus at any point in time. Okay? It always has the potential to come back. So herpes varicella here, that is chickenpox. Many of you got a vaccine for that. Okay? That's more common in children. It again has these itchy, painful blisters. It won't come back as chickenpox. So once you've had chickenpox, you should have lifetime immunity. What it can come back is as shingles, which is herpes zoster. This is an adult that had chickenpox as a child. So for instance, you all don't have the possibility of getting shingles because you didn't have chickenpox as a child, most likely. But shingles is a manifestation of the herpes zoster, of this herpes virus in adults. So reoccurrence of the herpes varicella. Again, you can see this blistery, painful rash that they have there. Okay? It'll follow, if you'll notice, this is kind of on a pattern here. It'll follow what's called a dermatome. Putting a quick text box in seems to be better here. It'll follow what's called a dermatome. A dermatome is basically a skin nerve pattern. And you'll usually see it on people around their chest or back following the dermatome, basically following the ribs, okay, following the skin sensation along a particular pattern there. Herpes simplex that you see down here at the bottom, okay, so herpes simplex, we've got herpes simplex 1, which is going to be your cold sores. And then you have herpes simplex 2, which is genital herpes. So again, just to stress here, these things don't go away. Okay? They do not disappear. So your herpes simplex 1 is your cold sores, and your herpes simplex 2 is going to be genital herpes. So even if someone is contagious when they are having a flare-up, okay, if they're not having a flare-up with an open sore or open wound, then they should not be contagious at the time. So another infection is the human papilloma virus. Okay, so human papilloma virus. You guys have probably heard about this one in the news, right? HPV. Okay, again, similar to herpes, there's a wide variety here. Human papilloma virus is warts. Okay, it is going to be some form of wart. And so you have common warts. These are what you see right here. So very common on the hands. Those don't usually require any kind of treatment. Okay, plantar warts, which would be on the soles of the feet. Okay, if you look at the picture there, you're looking at the bottom of the foot there. That's the plantar or the sole of the foot. Okay, so to remove those kinds of warts, you could do surgery. You could do cryotherapy. Okay, so let's list some of these for you so you can get your spellings. Right, so you could have surgery, cryotherapy, which is basically freezing it off. Okay, and there are some topical meds, like some creams and stuff that can help with that. Okay, the one you see in the news, okay, the herpes simplex virus that you're going to see in the news is going to be your genital herpes. My text box isn't working. Okay, there we go. Okay, so your genital herpes is the most common STD in the U.S. Okay, there are basically two types. There are low-risk HPV, what we call low-risk HPVs, and high-risk HPVs. Okay, low-risk HPVs are not known to cause cancer. High-risk HPVs cause nearly all cervical cancers. And so that's what the big to-do is about HPV, is that it can potentially cause cervical cancer. Okay, and so your high-risk HPVs cause nearly all cervical cancers, as well as some other cancers that can occur in the pelvis. Okay, so we looked at herpes infections, we looked at HPV infections. Let's look at some different fungal infections. Okay, so here we have a variety of fungal infections. So we have tinea pedis. Ped here means foot, right? And you can see obviously this is on their foot. So tinea pedis is our athlete's foot. It is your most common fungal infection of the skin. You're going to get this cracked, flaky skin kind of between the toes on the edges of the foot. This is very contagious. It's really hard to get rid of, and it is really hard. It's really easy to pass it on. Okay, this is why you wear flip-flops in the shower of like the locker room or the gym. Okay, so again, your tinea pedis is your athlete's foot. It's the most common. It causes this cracking and flakiness of the skin. Tinea, let's look at that picture. So this one, tinea unguium, that's going to be nail fungus. Okay? In particular, it's a toenail fungus. It gets underneath the nails, and you can see what it's doing to these nails. It causes discoloration of the nails. And if you look at those nails, they're significantly thicker, okay, than a toenail should be, okay, because this fungus is causing that extra growth there. Okay, another one we have here is Tinea corporis. So Tinea corporis is what's commonly known as ringworm. It's not an actual worm, but because of the shape of the rash, the fact that it has that red ring shaped there, okay, it looks like a worm on the skin. It's actually a fungal infection. It can be due to prolonged sweating. So basically constant sweating and poor hygiene. You're not letting the area ever, a lot of these fungal infections are going to grow because the area never gets dry, right? We're not drying in between our toes after, the shower. The ringworm, you're sweating a lot. Ringworm is more common in small children, right? You're sweating a lot, and maybe their bathing habits aren't super awesome yet. Okay? And so those would be one of the reasons why ringworm could develop, would be the poor hygiene and the prolonged sweating. Okay, let's look at a few conditions that could be due to inflammation. Okay, so the one we have up top here is pleurisy. If you remember that layer of that serous membrane that surrounds the lungs was called the pleura, right? And so this is going to be an issue with that membrane around the lungs. Okay, it can be due to, there's a lot of things that could cause it. You could have an infection, cancer, rheumatoid arthritis, lupus, some form of injury, a blood supply issue, pretty much anything. There's lots and lots of things that could cause pleurisy. What happens with pleurisy is that the membranes, if you look on the right here, you can see it. The membranes here end up sticking together. Okay, see how in this picture here of the healthy lung, the membranes are separated. There's the nice layer of serous fluid between them, so they can rub. They're not rubbing against one another. It helps decrease that friction. When you develop pleurisy, the membranes thicken up, and you can't. Every time you breathe in and out, those membranes, it's like saran wrap. They're sticking to one another and pulling on one another. It's really painful. Every inhalation they take, trying to stretch out their lungs, is extremely painful. Coughing is very painful. Okay, it can eventually cause fluid to accumulate in the thoracic cavity, which can then make breathing difficulty. Treatment can be a variety of things. If it's an infection, then maybe you just need some antibiotics to get rid of the infection. You may need some anti-inflammatories. If it's been going on for a long time and fluid has been building up, you may need to drain the fluid. Okay? That can also happen in the peritoneum. So if it happens in the peritoneum, okay, it's called peritonitis. So again, itis is inflammation. So this would happen in the peritoneum. Okay, and again, you're going to have issues with, it's going to be painful. When it happens in the abdomen here, there's something has accumulated there to happen. Blood, fluid, pus, something is happening there. The biggest thing with peritonitis, obviously, is going to be that it's life-threatening. This is immediate surgery to repair whatever damage caused it. Okay? You're going to need antibiotics to help possibly fight that off. Okay? But it is a life-threatening disorder. Okay, so let's look at this last one here, this psoriasis, which you've probably seen like the commercials and stuff for, right? So psoriasis is when you develop psoriasis, you'll notice the skin has gotten really thick there, okay? And it turns a little red, and it gets these flaky, silvery patches. That silver is characteristic of psoriasis. It's a very common thing here, this kind of silvery color that's flakiness there. Okay, they look like scales. It can be really itchy. It can kind of burn. Again, like a lot of skin disorders, it can crack. And so therefore, it can make you more susceptible to infection. Psoriasis is thought to actually be an autoimmune disorder. Autoimmune disorders are when your body is attacking itself. And so psoriasis is thought to be an autoimmune disorder where you basically are producing too many skin cells. It's not contagious. You can touch somebody that has psoriasis and you're not going to develop it, but it could be hereditary, which is again part of why they think it's an autoimmune disorder. Okay, I know we've thrown a ton of skin disorders at you. We're going to look at very briefly at skin cancer. We're not going to go into details with a bunch of different kinds of skin cancers. But we're going to talk more about kind of exactly what it is and kind of what to look for. You have some skin cancer that is going to be benign. Some of you may already know your difference between benign cancer and metastatic cancer. So benign cancer doesn't move. It doesn't metastasize. Let me get your spelling down for that. I can't spell at all. So it doesn't, basically benign cancer doesn't spread. It's not going to move from your skin to your brain, to your liver, to other parts. Malignant cancer, on the other hand, will. Malignant cancer does metastasize. It will spread to other parts of the body. We've just got some images you can see real quick, like basal cell carcinoma, for example. That's the most common. It's the least malignant. The squamous cell carcinoma over here is a little bit more serious. The malignant melanoma, hopefully you can tell by its name, malignant, and just kind of how it looks. This is the most serious form of skin cancer. So what you guys really need to focus on is what we call the ABC, come on, Pin, the ABCDs of cancer here. So if you're looking at your skin, right, and you're trying, doing your own self-assessment or scan for skin cancer, the things you would look at on your skin would be for things that are asymmetrical. So you may have a normal mole that is, I cut that in half and it's nice and symmetrical, or I have that, which is asymmetrical. So asymmetrical is not a good sign, right? We want a regular shape. You look at the border, right? Again, how this border is nice and smooth, but this one is all jagged and wrinkly. So again, we don't like that. We want nice and smooth and symmetrical. If you find things that are asymmetrical, that have this jagged border, that have color variations, right? Color variations like this one does, as well as they're larger than a pencil eraser, which is about 1/4 of an inch. Any of those are red flags that you would want to head into the dermatologist to get checked out. Asymmetry, irregular border, irregular in coloring, as well as a large diameter. Okay, I know that was a bunch of skin disorders, and all we really did was kind of run the surface of them, but we just want to expose you to them. So really what you guys are going to be responsible for is if we talked about symptoms, if we talked about signs, if we talked about treatment. Those are your big things, as well as your rule of nines and your ABCDs of cancer.